Hi everyone, my name is Jacqui Henry, and my main role is supporting the development of health and wellbeing programs at Shoreditch Trust. And Shoreditch Trust is a voluntary sector organisation and social enterprise, and we have been working for just over 20 years now, just simply around supporting people, and mainly through community-based health and wellbeing programs and training. And our organisation, we try hard to put people at the centre of design, delivery and implementation of our work, and at the centre of their support, most importantly. And our starting point over the years has been genuine kind of investment in people. And that might mean through volunteering, through training, through investment in local recruitment, and through developing approaches which are just genuinely centred around people. And that's been an ongoing journey for us, working with communities, just developing really relevant, meaningful, and hopefully trauma-informed ways of working. And that involves getting a lot of feedback from people and investing in staff, and particularly in staff training and awareness around this area. And we have collaborated a lot with Jonathan Tomlinson, who you will have just heard present, who is a local GP and a trustee of the organisation, and has been our trauma-informed advisor and mentor really over the years, and just helped us to really spend a lot of time reflecting on what it is we do and how we can constantly, I suppose, have a critical approach to what we do, make changes and adapt. And we have asked ourselves what feel like some really basic questions about trauma-informed support, and that is, what are the ingredients to a really good helping conversation? So what are the elements of that? Are there things that we're doing that are in the way? And if there are, how can we address that? And we've looked at our processes, and particularly at our first contact with clients, where we realized it was just becoming a bit of a data collection exercise. So a tick box, lots of questions, lots of measures, and we felt we were just really coming away from what we were about. It was starting to feel relevant to get to know the person and putting them in the centre. At worst, it was making people feel judged and diminished, and just really unable to talk about really sensitive, difficult issues. And we noticed also that my colleagues were struggling in this context to wade through all of that and just get to the really important stuff of getting to know the person and what's important for them. And so I guess what we've done is made a decision, even though we know we've got to evidence our work, we've made a decision that we need to kind of transform it a bit and just think about, we still do the essentials of data collection, but we want to prioritise, and we do prioritise now, more enabling conversations, coaching conversations, listening, and using that strengths-based approach and guiding and enabling people to look at their strengths and to really look at the life areas that are important to them. And we have developed something called a flourishing scale, which we feel has come away a little bit from standardized measures and more clinical measures that just don't feel right for our setting. And that's just a really broad discussion on, allows the person or guides the person gently through a discussion around their life and what it is that they genuinely would like some help and support with. And so, I mean, just to finish up, really, for us, trauma-informed care, as a community-based organisation, we're not a specialist organisation, we're non-clinical, we're non-medical, we're really about connecting people with themselves, with other people and with the community. And for us, that just means more control for the person, more sensitivity in the way we work, and just a really supportive environment down to our spaces and how we welcome people and the ongoing relationship that we develop, and not being defined by a specific issue or condition. And so that's just a little bit about how we've challenged ourselves to look at, I guess, what wasn't working for us and move towards a different system and a way of working that feels more authentic to where we're at the moment.
Thank you so much, Jacqui.